Hi guys, Dr. Stefano here. Very excited going down to the radio station to pre-record another episode of Recharging the Human Battery Radio. And my focus today is on two critical patient populations that really struggle to find good care for their conditions. They are blown off somewhat more than other groups that I have seen. We're seeing so much of this in the integrative health clinics, and I wanted to dedicate an entire show to talking about these two critical problems that so many people are suffering from and so many people are struggling to find care, and that is patients suffering with Lyme disease, which is the great masquerader, 476,000 cases estimated by the CDC each year, and that is really underdoing it because it's probably a lot more than that. And then mold toxin illness. EPA estimates about 50% of homes may have some sort of water damage, and I would say homes and buildings. And these two patient populations really struggle to find care. They have severe fatigue. They have all kinds of weird neuropsychiatric conditions. If you look at, for example, mold toxin illness, there are very specific syndromes that can develop, and oftentimes these patients are placed in buckets which have no understanding that they are suffering from a toxic condition, and they are treated in different and more standardized Western medicine ways, and they just don't do well. Now, functional medicine techniques have done a really good job of looking and trying to explore more of the root causes and have definitely made improvements in patients' lives. What I talk about on today's episode is really how some of the protocols that we are using at our clinics really focus on restoring the human battery component of it by utilizing physics and biohacking strategies, things like the Neuro 20 suit, which can really improve lymphatic drainage and help in these types of toxic conditions. Bottom line is, these two patient populations need much more focus on them. I've just recently written a couple of white papers on both of these conditions, and I'm going to continue to do that because, again, we're seeing so many of these patients now, and looking at this from a different combination approach, fixing the chemistry, fixing the physics on the other side. When you combine these two things, it leads to much more powerful results as far as helping their symptoms and helping them get back to reasonable quality of life. So very excited. Hopefully you can catch this episode. We will see you on the next video.